Hello, I'm Dr. Mike. In this video, we are going to talk about vomiting in dogs. There are a variety of reasons and scenarios that affect how we determine why a dog is vomiting. First, we need to consider if this is an acute problem. Did it start today? Or is it a chronic problem? Has it been going on for weeks? Then, we need to perform a physical exam and get some history on our patient. Unfortunately, dogs don't tell us that they got into something or what hurts. We have to do a little detective work. Let's consider an acute episode. Obviously, your veterinarian is going to perform a physical exam to determine how urgent or critical your pet is. During the exam, he or she will likely ask you a variety of questions. For example, when did the vomiting start? Did they vomit food, bile, or is it just gagging or retching? Environmental changes should be considered. Are there any toxins or chemicals in the yard? Most people don't think about the fertilizer recently placed on the grass or the rat poison put in the garage. Have you noticed your dog chewing on any plants? Puppies will eat almost anything. Both indoor and outdoor plants such as sago palms, oleander, and lilies can be very toxic. Dietary changes are another often overlooked factor. Did you change to a new brand of food? Did you give any recent treats or table scraps? Does your dog play with sticks, eat rocks, or chew on plastic or toys? These are all very important questions. When a vomiting dog comes into my hospital, some of the questions may vary based on the dog's age, breed, and lifestyle. For example, a 9-month-old Labrador Retriever that chews on everything in the yard is a high risk to have ingested a poison or possibly swallowed an object and may be obstructed. A different example is a 7-year-old Great Dane that is trying to vomit, but nothing is coming up. This breed is very susceptible to a problem commonly referred to as bloat, where the stomach actually twists on itself and becomes distended. Both of these examples are very different, and both are considered emergencies. After completing the physical exam, your veterinarian will determine the most appropriate testing required. Initial diagnostic tests may include x-rays to look for a foreign body, an obstruction, possible bloat, or even cancer. Blood work can be very valuable in diagnosing conditions such as pancreatitis, liver disease, kidney failure, or possibly a toxin such as antifreeze or rat poison. Additional testing such as ultrasound and endoscopy may also be recommended. We also mentioned chronic vomiting, that which has been going on for weeks or months. Many people don't call their veterinarian because it is simply a couple times the first week, and their dog is otherwise acting normal. Only after several weeks do they call. The veterinarian will perform a physical exam, ask many of the same questions, and possibly perform the same test as done with an acute episode. Diseases such as inflammatory bowel disease, liver or kidney failure, and cancer can all seem mild in their early stages. However, once in their advanced stage, they can be much more difficult to cure or even treat. With respect to treatment, there are many scenarios that will affect what your veterinarian decides to do. They may administer IV fluids and medication for cases such as pancreatitis or kidney failure. There are products such as activated charcoal that may be given to help absorb any toxins. In cases such as bloat or obstruction, emergency surgery is necessary. The bottom line is simple. If your dog just started vomiting, you need to call your veterinarian immediately for advice. Don't wait. I'm Dr. Mike. I hope this information has been helpful, and thanks for watching.